Hello everyone, and welcome to this audio podcast as part of the analysis edition. This is an audio podcast as part of a Bostic Summit and part of the manuscript Cyclone, and this is an analysis edition as part of another Storm of Bostics production. In this overview, in this audio podcast, there'll be an overview in around some as in some in around some retrospective works, in around some retrospective peer-reviewed works, with some with some specific specific updates as well. This works is in around coping in young people with CKD or chronic kidney disease, and where this works was original research from 2000 from 2000 and between 2010 and 2013, and 2015 was when the works was peer reviewed and published. 2015 2016 when the works was peer reviewed and published. So, retrospectively, young people in the ages of between 12 and 18 years with CKD or renal failure are cared for between 13 pediatric nephrology sites or centers in the United Kingdom. There's a guideline in around that's referred to as the Nephrology Network's 2011 sort of framework or guideline. Um, where listeners can access online. And the size of the regions and the population served, and the number of trusts, NHS trusts, from which the tertiary centre receives referrals varies, and thus the model of services is different across regions. At the same time, the care of young people with CKD or kidney disease is not confined to tertiary sites, and many young people live considerable distances, considerable distances from nephrology departments. Understanding how young people cope with kidney disease, therefore, or any long-term on any long-term sort of any long-term sort of illness, is important, considering many can feel less positive about sort of qualities about qualities, perceive less support, or be adversely affected by changes to environs, and placing them at a higher risk of poorer sort of functioning when compared to healthy peers. Um, there have been sort of literature review works by Mohammed and team in 2012 that sort of evidence some aspects in around sort of the underlying components of coping in works from 2012. So coping with CKD also means living with the risk for example, transplant rejection and other clinical implications. Um, this works was also peer reviewed and published, as mentioned, in 2015 and 16, and in the descriptives on social media there will be a link to there will be sort of citations available for listeners and to check out similar works as well. There are also specific requirements in providing adequate pathways for young people in CKD, and particularly in CKD stages 4 and 5. The multidisciplinary team, or MDT, in pediatric nephrology have responsibility for planning and educating families surrounding treatments, liaising not only with MDT colleagues but also with external services. And for example, transitioning between pediatric renal services to adult renal care, for example, from hospital environs to from hospital environs into municipal. And there are a significant cohort of young people with CKD who require specialist care, and there is a variation in the incidence and prevalence in forms of kidney diseases. A variety of approaches have been used to understand the experience of coping. And so in this original works, colleagues and collaborators sought to follow up previous literature review on coping and seek to answer the question, what coping strategies do young people utilize to enable them to cope? The team sought to involve two young people groups aged 12 to 18 years. CKD those with CKD in one group and a healthy cohort in a second group, implementing a sort of qualitative methodology approach. Before embarking on data collection process, the team required an understanding of a theoretical framework to pursue investigation. Several 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 sort of several sort of measure several sort of surveys have alleged to provide objective information about the extent to which young people cope with CKD. One investigation one investigation informs that optimistic coping style proves effective in young people with CKD, and some coping strategies utilized by young people include confrontive coping, support, and self-reliance approaches. However, coping data has not been established in a young renal population, and initially best practice guidelines in care of and for young people with CKD have been evidenced through for example, again, nephrology networks from 2011, and the guideline informed that young people with kidney disease should have access to information that enables them to make decisions and encourages partnership in decision making with an agreed plan with an agreed plan that supports young people with CKD. In this research, the team also sought to interrogate in literature encompassing similar research, and anticipated utilizing a phenomenological and methodological approach as part of the investigation, and wherein essentially collaborators seek to construct research free from hypotheses or preconceptions. Literature informed that phenomenological approaches are mainly useful to bring forth encounters and real viewpoints from participants, thus challenging theories and preconceptions. Phenomenological studies regarding young people with CKD and other long-term conditions have been carried out. This research also seeks to include an interpretive component, so that this would propagate investigative team to inform, support, or question policy and prompt action. This formed a basis surrounding literature, gaining an understanding of theory surrounding coping models and theoretical framework to pursue research aims. And through this investigation, the team embarked on ascertaining perspectives of young people through qualitative research. However, before doing so, there was also an effort wherein ethics application, which documented all aspects pertinent to both academic and NHS ethics research, was substantiated. An ethics application regarding CKD cohort was granted. An ethics application regarding CKD cohort was granted through the National Ethics Research Service and Southwest Committee and the Birmingham Children's Hospital research and development team in around June 2012. Ethics application regarding young healthy cohort from a youth club in Glasgow, Scotland, was granted in around April 2011 through the University of the West of Scotland Research Ethics Committee, respectively. All ethics-related documentation had been put forward for review as part of our process, including information sheets, consent forms, topic guides, and research flyers. Essentially, this research sought to collate qualitative data from a CKD, a young healthy cohort by a young healthy and young healthy cohort by inviting participants participants to inform research by answering semi-structured research semi-structured interview questions. Young people in the CKD cohort were identified by pediatric nephrology clinical nurse at the Birmingham Children's Hospital, whom also was a first point of contact for participants. Young people from the youth club were approached by youth club lead and contacted to confirm intention to participate. All participants were informed of the objective surrounding research and required permission from departments to participate. All participants were informed that any data is anonymized and confidential. Participants were also informed should they wish to withdraw from research, they could do so. The topic guide relating and regarding to semi-structured interview questions, co-developed between investigators and as a utilizing lit- and as a u- and as a utilizing a literature and utilizing literature review works by uh, by 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 peer review works by Mohammed by one of Mohammed's one of Mohammed's earlier papers around the subject entity as a basis. The publication also outlines interview guide and semi-structured questions. Having collected data, the team looked to utilize a thematic analysis approach to analyze the data. Thematic analysis offers a flexible approach to analysis and propagates gain propagates propagates a, com, a, com, propagates a basis in around an account of the data and the publication output and the publication the publication output around this works or the peer reviewed works includes an overview of different phases and processes linked between the analysis. Research software also allow data analysis through coding transcript to identify themes. The main findings identified in the publication or in the peer-reviewed works include number one, anticipating a challenging scenario; two, close relationships; three, coping strategies; four, demonstrating resilience; five, exercise; six, making decisions; seven, pastimes; eight, peer pressure; number nine, stress triggers; and 10, worst case scenario. This research identified that depending on situation, young people between both cohorts were able to utilize coping strategies ranging from problem focused and emotion focused coping to more passive strategies such as avoidant focus or such as avoidant focused or style strategies. Participants in CKD cohort, as in the healthy group, utilized anticipation, developing resilience, and communications as counteractive approaches where applicable. In several cases, there was evidence of steps being taken to enhance coping through physical activity, relaxation, and pastimes. Some young people used a variety of coping strategies, perhaps because of the time being a long term CKD patient, whilst others require more formal more formal support. Aligned to current research, young people coping with long term conditions or LTCs also requires autonomy, requires autonomy surrounding several aspects, including primary care in around polypharmacy, in around biopsy and surgery, in around, for example, nutrition, lifestyle aspects around nursing, and in around physical activity and peer support. Primary care at the same time is on the front line of healthcare. And however, additional involvement of nephrologists in management of CKD patients have been linked to sort of better prognoses in CKD patients between CKD stages 3 and 4 in community. Increasing access to allied health professionals or AHPs to support CKD patients also represents an important service provision wherein CKD patients can access health professionals online and according to scenarios would be advantageous. Therefore, there have been several publications. Um, there have been several publications investigating care between healthcare sectors, and so quality of educational support, educational efforts would help provide pertinent understanding surrounding service provision. Primary care services also traditionally have been linked with medicines and overprescribing services. In this context, polypharmacy has been linked with higher risk of adverse drug interactions, morbidity and mortality. For young people, it is important and to quickly identify inappropriate medication, as this can increase poor health outcomes and adverse events. And dose adjustments or certain drug avoidance in young people can prevent renal insufficiency, and also prevention of potentially toxic drug levels, drug trough levels across drug spectrum. Educational efforts are required to support CKD patients. Aligned to Aligned to coping and in context of secondary care services, CKD patients can tend to have anxiety surrounding renal replacement therapies or RRTs, transplantation services, and allograft rejection. In this publication, there have been perspectives from young people surrounding surgery, for example, a biopsy. A renal biopsy is an essential yet minor surgical procedure used in diagnosis of CKD and manage potential acute allograft rejection in post transplanted recipients. Biopsy and surgical procedures, including dialysis access, transplant surgery, parathyroidectomy, etc., are interventional procedures as part of the CKD pathway. However, surgical procedures vary depending on underlying diagnoses. Age is not associated as a risk factor of complications during renal biopsy, but can be a factor in recovery of CKD patients. And research also has also informed that educational efforts are required to support CKD patients' understanding of surgical procedures, and again increasing access to AHPs, allied health professionals, to support CKD patients also represents an important service. Through this research, some participants highlighted perspectives surrounding nutrition owing to renal replacement therapy and restrictions. A high protein diet, for example, can attribute to the accumulation of toxic metabolites and has been associated with glomerular hyperfiltration, increased excretion of urinary albumin in specific renal diseases, and progressive glomerular damage and sclerosis. One investigation has informed the impact of protein may depend on the type of protein sources, especially red meat, which has been strongly associated with end-stage renal disease. The advantages of protein restriction in patients with renal insufficiency can prompt nitrogen waste products and lower intraglomerular pressure. Higher protein intake for patients on renal replacement therapy should be encouraged to avoid muscle breakdown, bone dystrophy, and hypermetabolism. Protein restriction is also beneficial in lowering protein by 20 to 50% in patients with chronic kidney disease or CKD. High dietary sodium high dietary sodium causes renal damage, and this thus influencing hypertension and fluid retention. Participants also had various perspectives surrounding restrictions, perspectives surrounding restrictions in around physical activity, hobbies, and pastimes. Physical activity has been a known has known advantages in end-stage renal disease patients. The most important has been evidence in literature, including in literature include enhancements surrounding health-related quality of life or HRQOL, well-being and physical functioning. Physical activity has been documented to reduce symptomology relating to particular and specific comorbidities, and low levels of physical activity are associated with malnutrition and inflammation. Hemodialysis recipients or patients can often be perceived as inactive, and nephrologists do not partake in advice or guidance to increase activity. CKD healthcare has progressed, however, educational efforts are required, wherein there is AHP collaborative, there is Allied Health Professional Collaborative and MDT effort for CKD patients. Young healthy participants in this research, although did not have the same medical or clinical healthcare implications like the young people with CKD cohort, had highlighted challenges pertaining to a healthy lifestyle owing to deficiencies surrounding support systems. Literature informs that having a healthy lifestyle has positive effects across physiological parameters, and reduces the risk of multimorbidity and incidents with albuminuria. There have also been investigations surrounding abnormal phosphate and progression amongst pre-dialysis or dialysis recipients. Given high prevalences and incidences of CKD in population health, there is a requirement for educational initiatives to be prompted between healthcare sectors surrounding lifestyle medicine, and wherein allied health professionals (AHPs) support services. This research had also highlighted that young people in pediatric nephrology services rely on nursing staff and nurses as AHPs and are involved to encourage autonomy and decision making. For example, administration of medicines such as erythropoietin or EPO injections, dialysis treatment protocols, and understanding surrounding osteodystrophy and insomnia. Aligned to nursing care, understanding of CKD and renal replacement therapy (RRT) affects young people, including peer support, understanding healthcare career motivations, and lives would help and lives would help support more integrated practices. Young people have reported renal failure as has an impact on aspirations. RRT has a negative impact on activities and personal relationships. CKD can have an impact on confidence of young people and ability to become established and maintain relationships. Online communities and peer support are helpful, allowing patients to gain lived experiences, develop and expand network. There is a requirement for educational services to be prompted between healthcare sectors surrounding peer support services, and when educational support against scenarios to offer CKD patients understanding of nursing care, peer support aligned to young people services. The research team had established one that coping is intricate, and it was important to understand which coping strategies are useful. Number two, coping depends on appraisal of whether action can be taken aligned to circumstances to change the situation. If young people anticipate challenges, problem focused coping predominates, thus alleviating challenging situations. Number three, young people with and without chronic illness contend with various encounters. Some coping strategies are more helpful than others across challenges. And four, coping strategies change from one stage of a complex stressful encounter to another. So an understanding of what challenges healthy young people and young people with CKD have to contend with was necessary. Research informs that when treatments are continuous, real issues can be camouflaged. But in CKD, issues can appear at school, work, or with family, and these are concerns health professionals should seek to understand. The responses used in challenge are referred to as problem-focused coping strategies, and some are associated with increases in positive emotions, and others are associated with increases in negative emotions. Problem-focused coping can include problem solving, information gathering, goal setting, and problem-orientated. For example, following invasive drug regimes, following invasive drug regimens and collaborations between following invasive drug regimens. So for this research to be successful, there was a necessity for cross collaborations between colleagues at the University of Western Scotland, a youth club referred to as the Royston Youth Action in Scotland, and the Birmingham Children's Hospital. The team had identified that ultimately research surrounding coping in young people with CKD, with chronic kidney disease, had been under investigated. That draws this audio podcast as part of this analysis edition to a close. Again, there will be a list of there will be citations on social media aligned to this with this work, so listeners can check out works similar to this, and along with this, there will be another 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 audio podcast aligned to this analysis edition to follow. So thank you for tuning in, and this has been an audio podcast aligned to an analysis edition, a part of the Bostic Summit and the Manuscipt Cyclone. This has been the Shientist with another Storm Bostics production. Thank you.